Good day. This is Rizwan Butrar, Chief Innovation Officer at INNONATION. Today with me is Dr. Shafeeq Haider, who is Director Life Sciences at Zauq Health. I have known him for over a decade now, and he's one of those very interesting personalities who have never hesitated to implement and experiment with innovation and creativity in healthcare processes. He has several decades of experience. He has been into medical point of care operations, medical management, ICT operations, and most importantly, with the background of current epidemic situation, he's one of those very few Pakistanis who have applied and practical experience of working with a very recent epidemic from the early 2013 to 2016. That was the time that Ebola had hit West Africa. So we'll talk about lessons learned from that epidemic, and most importantly, how those lessons learned can be applied to Pakistani context with the current pandemic. So we start with the welcome you on our show, Dr. Shafeeq.
Thank you very much.
So let us know that what had happened in West Africa, what took you there, and how you had first-hand experience of that epidemic.
Thank you very much, Rizwan, for giving me this opportunity to share this unique experience. In West Africa, Ebola started from Guinea. That was in December 2013. And after a span of just 5-6 months, it is spread in all the neighboring countries, including Liberia, Sierra Leone, and all the adjacent countries. I was in Liberia in early 2014, and I saw the whole trajectory in front of my eyes as to what has happened, and it's it's an experience to share. I mean, there are so many parallels with Pakistan, and I want to share. And and I was there. I was sent by a Canadian group, and we were doing hospital turnarounds or establishment of new healthcare facilities. So we were in touch with the public sector there and the private sector there, and we also saw the demise of the existing healthcare infrastructure. It was already very weak. And when the Ebola strike, it struck Liberia. I was in Monrovia City. It struck somewhere around March 2014. And you see, the borders were very porous. The people, the infected people were coming from Sierra Leone, from Guinea, and there was no border control. And the healthcare infrastructure was dilapidated. And it was already overwhelmed, and those were already very, very poor countries, you see, and that Ebola created havoc, and it took them they declared Ebola free in 2015, May 2015. It took them a year to overpower this, and with the support of U.S. government, President Obama sent a special force to help them, and that's how I was there. I was working for Canadians.
So being a Pakistani, seeing that first-hand similar environment, maybe rather low and middle-income countries have their challenges. So what happened with the healthcare facilities? How well prepared were they? And later, how they cope up? Especially the frontline healthcare workers, so how you saw them coping up with them with the little resources that they would have, and then when the resources actually came, were the resources helpful in their setting? Because generally when the aid infrastructure equipment comes, most of the times the training is missing with healthcare worker.
Correct. Well, that was very sad. In fact, when the Ebola struck that nation, all of these countries were not prepared at all. In fact, they had no infrastructure. I mean, you may be surprised to know that in whole Liberia city, there was not a proper single hospital in the whole country. I mean, they used to take patients, they used to take triage out the patients from Liberia to the neighboring countries. I mean, the infrastructure was so poor. And when Ebola strike, they were not prepared. The government was not prepared. The private sector was not prepared. They were not trained. They did not know what is going on. And in fact, in the early days, that was around March 2014, March, April, May, most of them were in denial. I mean, you see, the common men were in denial. The government was in denial. They were, and the government has their own, dynamics, and there are a lot of issues. And but once they saw deaths in the neighboring countries, and then they started, realizing that, look, this is very, very serious. See, there were, as usual, conspiracy theories, and X has done this or Y has done this. But after some time, the common man realized that this is a real threat. They all the Minister of Health and all the stakeholders, they sat together and they tried to work out a strategy. They realized, by the time they realized the gravity of situation, it was already too late. It was very, very late. Anyway, and you may be surprised. It was very sad that half of the workers of Ministry of Health died. Half of the whole ministry wiped out. Ministry of Health, including the Minister of Health himself and the Deputy Minister of Health himself, because they were not prepared. You see, and they took a lot of time, in tackling the denials and the mismanagement and this stuff. Yes, the aid came, but it came very, very late, and the aid came just because of the personal interest of President Obama. Because of the historical linkage with that country. And initially the mistake they made, they made isolation centers inside the main cities, and which led to further spread of the disease. So after a few months, American Army came. They took over the charge. They opened specialized isolation centers on the outskirts of the city. You see, they isolated those patients, and it was very sad. I mean, I saw deaths, people lying, the dead body lying on the streets of Monrovia City. You see, and in around August or September 2014, they were looting. You see, there were law and order situation created. So it was very sad. It was very alarming, and for Pakistan, there are many lessons learned. We need to learn. I mean, everything what happened there, I am seeing it happening here, and there are a lot of lessons to be learned.
So you would have a prior with very precise and accuracy, an anticipation of what the future looks like, what challenges the healthcare system would face, and we can prepare in advance for that. So how did they tackle, and if we learn those lessons in Pakistan perspective, what are the things to do, when, how, and how we should prioritize them?
Number one thing is PPE, most important, because initially Liberia and all those countries, they were focusing on, let's get antibiotic, or they were focusing on treatment, and their healthcare workers, they never had adequate PPEs, the personal protective. I saw myself the Minister of Health without any isolation gown, without any glove, and they were treating patients. They were trying to save patients. You see, so I think I mean, we can learn a lot of things from Liberia. You see, the most important thing is you must give these frontline workers. They are your frontline army. These are your first responders. Give them arms. I mean, you need to give them PPEs. If you don't give them, I mean, this would be disaster for themselves and, of course, for the country. This is what happened in Liberia. By the time they realize the importance of these healthcare workers, half of the healthcare, half of the strength of the country's whole workforce of the country wiped out. So I think we should immediately give PPEs, personal protective, and real PPEs, not those PPEs with false hopes of protection. We should give a high quality personal protective to our healthcare workers. And of course, then come the social distancing and the lockdowns. These are the only few things which we can do, which we tried to do in Liberia, but we were very late at that time, and we suffered there. So I see it happening here in Pakistan, unfortunately.
So thank you, Dr. Shafeeq, and we look forward to host you again for another round on how, as the situation proceeds, and how to cope up with it. Thank you.
Welcome.
Bye-bye.